Now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning.
Morning.
So the new administration moves in. They say there was absolutely no plan for distribution whatsoever. I remember the Trump administration saying, hey, we got it to the states. It's their job to get it out. What's going on here, and how long will it take to turn things around?
Well, the reason why the Biden administration had very little transition planning from the time of the election until the inauguration yesterday was that really there wasn't any plan. They gave the money out. The companies made the vaccine. The military actually set up some distribution points, and that was it. That was the entire plan. That's not how you deal with a pandemic. Now, can this be turned around? Well, yes, it's not going to happen overnight, but you already outlined this morning some of the things that are going to be happening. FEMA is going to be involved. The National Guards are going to be involved. There's going to be $400 billion poured into pretty much the state distribution system. The Defense Production Act, which should have been invoked, almost on day one, or at least in the first couple months, will be invoked. Companies are going to have to comply with that. It's not going to be a commercial decision any longer. It's going to be a public health decision. So all those things can turn things around. This group has stated publicly multiple times, 100 million doses in the first 100 days. They're going to work their butts off to do that, and we've got to keep on them to make sure it does. But this new leadership is great. I mean, it is a fantastic group of people running it. So I have all the faith in the world that this is going to happen.
A lot of Illinois seniors saying they still don't know where to sign up for these COVID-19 vaccines, even though they're eligible. Where do they sign up?
It's a mess. It's a mess. Patients are calling me, how can I sign up? It's all over the place. This isn't going to change overnight. So the state has identified new sites, and they're going to get money now to fund this. The city has identified sites. How you sign up for them is still a little bit of a mystery, but they're talking about next week this is going to happen. All the hospital systems are going to have their own plans. The pharmacies, Walgreens, CVS, the big pharmacies are going to be doing it as well. I understood in the news this morning that the Walgreens was actually taking applications or letting people get on a list or something. All that's going to happen pretty much all at once. I think it's going to start next week.
All right.
All right, let's get to viewer questions. This first one says, me and my family all had COVID-19 at the beginning of the year. I heard we will be immune for the next 3 months. Do we have to worry about catching this new strand of COVID-19 that's going?
Well, there's a couple of things about this question. Number one is you may be immune for longer than 3 months, maybe 6, 9, 12 months. We don't really know yet how long your immunity will last, and it probably varies a little bit person to person. An asymptomatic person or somebody who had very little symptoms probably isn't going to have the strongest immunity, whereas the ones that kind of really got sick, got a bad flu-like illness, they probably have better immunity. That really remains to be seen. It's very hard to measure. The problem, though, is with the second part of the question about the variant. Right now, the variant that is out there, this is a virus that's mutated. And maybe the antibodies that you made from your old infection or from the vaccine won't be as effective. So far, so good. The vaccines are working against whatever is floating around in the world right now. However, that has a possibility of changing. So it puts us in a race to get the numbers down and the vaccine out there before it does mutate, and then we've got to start all over again.
All right, next question. What exactly does the efficacy rate mean for vaccines? For instance, I'm over 65, have received the first dose of Moderna. They're saying in my age group, the efficacy rate is about 84%. Does that mean that 84% of people who get it will have immunity, or that we will all have immunity but only 84% of the full rate? Would an antibody test afterward give it clarity?
Okay, so this is a great question because it highlights a couple things. One is everybody that gets the vaccine or everybody that gets COVID gets some immunity. And as we saw in these vaccine trials, even the people that got COVID had a very mild disease. So you get some protection, but maybe not enough. This lady's talking about the Moderna one. I looked at the interim report there. So what happened is they had 30,000 patients in their study, and they got 95 cases of COVID was their primary endpoint. And 90 of the 95 cases were in the placebo group, and 5 were in the vaccine group, which gives an estimated protection value of 94.5%. That's where that 94.5%, those are the actual numbers. So it's the amount of protection you get compared to doing nothing, taking placebo.
All right. If you have a question for Dr. Murphy, you can post it on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks, Doctor.
Okay, see you tomorrow.
All righty.
you.
Hey, Paul.